Patty Hajdu is the Federal Minister of Health. Hi, Minister. Good to have you back on the program. Thank you for making the time.
Great to be here, Vashi.
I'm sure, Minister Hajdu, you, like Canadians from coast to coast to coast, are watching these case counts and increases in hospitalizations with worry. I note your tweets over the weekend referring to the number of vaccine doses the feds have sent the provinces and how many of those have been distributed. I know you said you just wanted to put the facts out there, but I'm wondering, was this also about politics? Because provinces had been pointing fingers at the federal government in the lead up to those tweets about supply.
Well, I think there's been a lot of confusion, Vashi, in terms of what has come into the country and what's been administered. And of course, there's a very vocal conversation happening in many provinces about prioritization. So the intent was really to make sure that Canadians had the most current information, including links, by the way, to the province's websites around their plans so that they could have for themselves a good, easy source of information. And we'll be continuing to do this week over week so that Canadians can follow along.
So there was nothing in there that was kind of an attempt to say, hey, I know you're accusing us of messing this up, but here's the truth about administration.
Well, I think, listen, there's been a lot of numbers flying around and a lot of people talking about a lot of different, kinds of speculations around vaccinations. And I think it's just really important that we have a way to provide Canadians access to information that's province by province, territory by territory. And that includes information that they can sort of drill into, what's happening in which phase of vaccination. Take Ontario, for example. I mean, I understand they're entering phase 2 this week, and that will hopefully address some of the anxieties people have around a variety of different groups getting access to vaccination. So this is just a way for Canadians to click on the link that's related to their province, get that deeper information. And as I said, we'll be posting similar tweets week over week so that Canadians have a clarity about what's arrived in the country, what's been distributed to provinces, and what provinces have been able to use.
You reference, Minister, the province of Ontario, and the Premier of that province said that they just received the doses that you're referring to and that it takes a day to distribute them. He kind of pushed back against the idea that they were sitting on doses from the federal government. Does he have a point there?
Well, my tweets just clearly just said, essentially, here are the doses that we have delivered to provinces and territories, and here are the doses they've administered. And next week, as I said, we'll update those numbers. And again, Ontarians, Canadians from coast to coast can follow along. They can check their own province or territory. By the way, this information is all publicly available. It's not new information. It's not, a separate spreadsheet that we have. This is information that we've got on the Public Health Agency of Canada website. We've got this, provinces and territories have this information available. It's just not very clear in some cases, and it's hard for people to find. So we thought this would be a helpful tool for people as they're having these conversations about vaccinations all across the country.
And just to confirm, Minister, the totals that you put out there, those are all vaccines that you have distributed. They're not expected arrivals, for example, over the next
That's correct.
Okay.
That's correct. Yeah. And each week, like I said, my plan is to update that so Canadians can understand how things are changing from week to week.
And I certainly acknowledge there are a lot of questions for provinces about those numbers, and certainly we'll be asking them on this program tonight. But overall, when Canadians do, for example, look south of the border, they see the president today signaling that he might advance, or he probably will advance by a couple of weeks, how soon every single adult in the United States will have access to a vaccine. And they're hearing that date is somewhere in the middle of April. By comparison, we're looking at probably months later at the rate that things are going right now. Can you understand a sort of feeling of envy and frustration that Canadians have when they see that?
Of course, listen, everybody, I understand that Canadians have sacrificed a tremendous amount over the course of this pandemic. And it is without question that people are afraid, that people are anxious, and that people are looking forward to getting their lives back. And we know that every vaccine is a step forward. We also know that there's a lot of hard work, even in some states that have high degrees of immunization. We see rising cases. So this is still a lot of work, but we are getting near to the finish line, and it's going to take everybody working together to keep the cases low, to keep vaccinating as quickly as possible, to stay focused on saving lives. That's what this is all about.
But can you understand, and does your government bear some responsibility for that relative feeling that a lot of Canadians might have, given they see President Biden saying, and I take your point around states, but overall, I mean, they have double the number of people who have one vaccine dose than we do. Though their cases are increasing in some states, the number of deaths, I believe, today was down 24%. Can you understand how Canadians would feel as though, and does your government bear some responsibility, that we are behind?
Well, I think we've been really clear all along that we had a very aggressive strategy, knowing full well that we don't manufacture vaccines in Canada and we don't have the capacity from a biomanufacturing state to be able to manufacture especially these complex vaccines right now. And that's why we had such an aggressive strategy to get a variety of diverse vaccines into this country, hedging our bets so that we would have a number of different suppliers just in case something went wrong with manufacturing or exports. And in fact, that strategy is paying off. We are getting a steady supply of doses into this country. And yes, we've had bumps in the road. And I know that has been very hard for Canadians. Do I understand that people are scared and frustrated? Absolutely. But I want Canadians to know that we are pulling out all the stops to get as many vaccines into this country as early as possible.
Any chance that the U.S. might share more than the initial loan of 1.5 million doses of AstraZeneca? And I ask because last week I remember hearing Dr. Fauci say that they probably will be able to vaccinate the portion of the population they're hoping to without any AstraZeneca. Is a conversation ongoing, or have you been provided with any assurances that perhaps we might be able to access more than those initial 1.5 million doses?
Well, I know Minister Anand and indeed the Prime Minister and his team work on a regular basis with trying to accelerate doses and trying to look towards our relationships with other countries as part of that solution. But I don't have specific information about the American intent in terms of their excess doses that they may have. What I can say, though, is that it's in the interest of all countries to work together to make sure that we can vaccinate the world, because indeed none of us are safe until all of us are safe. And I think this pandemic is demonstrating that in a very profound way.
Specifically in the North American context, we've also spoken to politicians who represent areas right along the border, both from the U.S. and Canada, who are anxious to see some kind of plan targeted towards a reopening of the border. From your perspective, do you think something like that is possible by the summer? Like, do you think if, for example, most Canadians have their first shot by June, sometime in July, we could see a relaxation of the restrictions at the border?
Listen, we're monitoring a number of metrics very closely, including our own domestic spread, including international COVID situations, and really with the first and top priority of reducing importations and protecting our healthcare systems and saving Canadian lives. So those conversations are ongoing. And I know it's really difficult to have restricted movement, especially internationally, when we have such a long land border. But I do want to remind Canadians now is not the time for non-essential travel. We know that it is precarious in a number of countries, including the United States and a number of different states. And so it's very important that we continue to stay put and that we curtail our non-essential travel.
I take your point on all of that. I guess what I wonder is they have been, and this, we've talked to Congress people, we've talked to mayors along the border here. They're anxious to find out if the federal government will produce at least a plan through which they say, okay, here are the metrics for a gradual reopening. Here is a date that we can somewhat think about targeting. Is that plan in the works?
Well, certainly we have an ongoing conversation with the Public Health Agency of Canada, with our provincial and territorial counterparts, who, by the way, are doing the heavy lifting on managing healthcare systems and protecting Canadians in terms of their healthcare situation. So this is an evolving situation. What I can say right now is that we're in the middle of our third wave, and we have rising cases across the country. So it's really, really important that Canadians curtail non-essential travel.
Is it fair for me to interpret from that there's no specific day in the works at this point?
Well, I think to pick a date would be, in my mind, somewhat foolhardy if we're not attaching to that date metrics. And as you mentioned, there are a number of metrics that we can look at to determine the safety of Canadians. And so I would say that it's important to, scope in things like, what is our own domestic situation? What is the situation internationally?
Okay, I'll leave it there, Minister. Thanks very much for your time. That's Federal Health Minister Patty Hajdu. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.